Hello, this video is to show you about the dermatology station as part of the second year OSCE. Essentially, this assessment is an unmanned station. So you will come into a cubicle in the clinic, you will be left with a touchscreen device such as this laptop here, and your first slide will give you a list of instructions. Now, to go with this, you will also have a answer sheet that you will need to write on with your responses. And effectively, this station is a brief slideshow comprising of 5 images, and those images will be related to cutaneous pathology. So could be nail, likely to be skin. And as part of the assessment, we're expecting you to be able to offer diagnosis, possibly differential diagnosis, and possibly a description or definition of the image that's presented to you. Effectively, you've got 6 minutes for this station, and as I said, you have 5 images that you'll need to look at. So the first thing you'll be presented with is an instruction slide, which just tells you that you're going to have 5 slides. There may be some arrows pointing towards the area of interest in terms of cutaneous pathology, and then you answer the questions that are asked of you on the accompanying question sheet. So just as an example, that could be the image that comes up, and you may be asked the question, give a diagnosis. So in the instance of this, you may say, the diagnosis is gravitational eczema, aka venous eczema, aka stasis eczema. Any of those terms would be absolutely appropriate. You may be asked for a differential diagnosis. So you may give a differential diagnosis such as contact dermatitis, for argument's sake. Now there's flexibility here because obviously dermatology is a tricky thing and many skin disorders will replicate others. And without having a patient there and being able to take a full history and be able to really look at the skin, it can be sometimes quite difficult. So there is some leeway, there's some flexibility there, and it may well be that you don't get the correct diagnosis, but if the diagnosis you give is a reasonable differential, you will still get credit for it. Okay, so have your best guess at what you think it might be. My tips for you here are thinking about the distribution of the skin rash or the eruption that you're looking at or the lesion it is that you're looking at. So where is it and would that fit with this diagnosis that I'm thinking it might be? You may then also be asked to give a definition or a description of your chosen diagnosis. So if your chosen diagnosis were stasis eczema, then your definition would need to relate specifically to your diagnosis of stasis eczema. So this really just needs to be very brief, very succinct. 1 line will be sufficient. This isn't an explanation, it's just a very brief definition. So for example, you may say a non-infectious inflammatory skin disorder associated with venous insufficiency. And that would be perfectly fine to satisfy the marks.